Well, I'd like to thank all of the speakers for wonderful talks in this session, looking at the effects outside the eye in aniridia, in individuals with aniridia. Beth's talk, I think, would have been understandable to all. She gave a wonderful description of her severe sleep disturbance and what major effects sleep disturbance can have on daily life. And this again highlights the need for clinicians to listen to their patients. Interestingly, and there was a very positive effect from taking melatonin. Beth's talk was a great introduction to Russell Foster, who gave a wonderful talk and very clear description of the biological clock and how light and other factors can modulate this. He told us a lot about the different types of sleep disturbance and highlighted the fact that disturbances of sleep-wake cycle can have major disturbances on general health. And I think finally, the part that would interest a lot of patients is his research looking at potential future therapies, which holds out promise for helping to treat sleep-wake disturbances. I think an interesting part of his talk was the fact that there was, in experiments, there appears to be a very small biological effect of melatonin, despite Beth's findings. And although he did point out there's been no trial of melatonin in subjects with aniridia. The next talk by Lina Lopez Noriega would have been of great interest to clinicians and scientists, but may be a little bit more difficult for patients to understand. Basically, she talked about the role of non-coding RNAs in regulating how genes are switched on and off. Now, most people know about RNA, which is copied from the genetic code of a gene and is the first step in assembling proteins. But it's discovered there are bits of RNA that do not result in assembly of proteins, but have other roles. And Lina explained that these non-coding RNAs have a role in switching on and off target genes. And she and collaborators have investigated one non-coding RNA that sits very close to the PAX6 gene. And non-coding RNAs that sit close to genes can switch them on and off. And she explained how her experiments have demonstrated that this RNA can, affects PAX6 expression and downstream affects insulin expression and glucose metabolism. And when she modulated this non-coding RNA to push to increase it or to decrease levels in the mouse, there was abnormal glucose metabolism. So this research may provide a very important link between PAX6 and glucose dysregulation that we see in patients. Now, Maria's talk was a very clear talk about the role of metabolomic studies. As she points out, the metabolites are very small chemical compounds in the blood. And it's possible to look at a lot of these at once in very clever experiments. And she looked at more than 1,000 different metabolites in patients with aniridia and compared them with normal subjects. And this allowed her to identify some biological pathways that were dysregulated compared to normal subjects. And again, this work emphasizes that in aniridia, there are effects outside the eye. And as Maria points out, the next step is to try and find out what the effects of these changes are, what effect they have on patients. I think the final talk was a great illustration by Kelly Trout of the importance of patient registries for very rare disorders. And WAGR, as she points out, is a very, very rare disorder. And her patient registry, which has 91 patients from with international participation, by asking many different system questions of different organ systems that doctors may not ask about, has highlighted the fact that in WAGR syndrome, there are effects outside the usual organ systems that doctors think about. And this has practical effects because it allows us to think more clearly about biological pathways, but more importantly, it leads to a list of specialists that patients and parents of patients should ask their doctors to refer them to. So overall, a very, very interesting session, and we look forward to your questions.